Miss Bridget. How are you today?
I'm good, thank you.
Okay, my name is Cynthia and I'm the intern pharmacist. I'll be helping you go through the process of how to take your blood glucose level, okay?
All right.
Okay, great. So first thing, you want to make sure that you're working in a clean environment, okay? And then I would always suggest that you rub your hands together to create a friction, just because you want to increase the circulation of blood in your hands, okay? So once you've done that, you go ahead and wash your hands. Wash your hands with water and soap, or you can use an alcohol swab. So the next thing you want to do is to get your glucometer ready. So here is your glucometer. You have your alcohol swab, you have your bandage, you have your lancet with a needle, and you have your glucometer strips that you're going to use to insert in the glucometer. So what I'm going to do, I'm going to get my glucometer ready. So I'm going to get one strip out of here. You always want to make sure that the side where you're going to put this blood sample is facing you. So do you see this? Yeah. So it's facing me. So I go ahead and plug it in. You always want to make sure you get this message to make sure that your glucometer is ready to collect your blood, okay? Yeah. So once that is done, I'm going to go ahead and put on my gloves and I'm going to show you how to do that, okay? You always want to make sure you have gloves if you're doing it to someone else, just so that you don't get in contact with the person's blood sample. So, can I have your hand, please? Always make sure it's a little bit below your heart level, okay? Which finger do you prefer? What finger do you go with? This one? Okay. So, you don't want to puncture your finger in the middle. You want to do it sideward, okay? You always do it sideward. So, I'm going to go ahead and swab, okay? Remember to always clean the area that you want to puncture first. And you don't need to blow it. You can just let it dry on its own without you blowing it. In the meantime, I'm going to go ahead and take off the, get it ready for puncture. It's going to be quick and it's not going to hurt, okay? There we go. Next thing you want to do, you want to press your finger to get the blood out, okay? And it's always good to wipe off the first layer of blood, because usually it's diluted, so you want concentrated blood. So I'm going to press a second time to get your blood out, and I want to make sure that I get enough blood so that I can feel the strips with it. This looks good, okay? And you take your glucometer. You wanna put it straight. You don't want to do this, okay? Or you don't want to do this. It has to be straight. So I'm gonna go ahead and collect your blood. And let it down. It seems like the glucometer went off. Okay, no problem. We're just gonna go ahead and change the strips and replace with a different one. This can happen, okay? So when it happens, you don't have to panic. Just make sure you change it. And remember, it has to face you, okay? Okay, so we're gonna go ahead and do that. And let it sit to get the result.
Your blood glucose reading is 133 milligrams per deciliter.
Okay, so normal blood glucose level for a non-diabetic patient is usually around 80 to 100. In this case, your blood glucose level is 133 milligrams per deciliter. So you might have probably just eaten a food that had a lot of sugar in it, okay? So I would say you wait 2 hours later and try again, okay? Yeah. So once you're done, you can close it up. It's up to you, however you feel comfortable with it, if you want to close it up or not. Okay. Let's see. Very sticky.
Thank you.
Okay, Miss Bridget? Thank you. And that's how you do it. Once you're done, you have to clear off your area. Make sure you put them in an appropriate trash bin. Okay? And you can dispose